She was a wonderful mom, and she was the mother of 6 children. She worked at one of the local hospitals for many years and retired in 1988. It was, I guess, in August 19th. My daughter had come down from New Jersey, one of my older children, and they were there, and we were all visiting and stuff, and we went to bed the night before, and everyone was happy and whatever, and we got up the next morning, and my youngest daughter had to come out of her bedroom, and her hallway into my mother's room was right there, and she could see in my mother's room, and she was sitting in her chair, and she was slumped over, and she thought that, gee, you know, Grandma, what's wrong? Are you having a problem? And she ran in, and she couldn't respond to her. She looked at her and whatever, and she had a massive stroke. Everything went so fast then. It just, you know, we had a lot of decisions to make. And
doctors always want to think of the next thing they can do, the next surgery, the next pill, and we have to consider that we're treating a human being. We're not treating just some disease on a slide. This is an actual person, and we need to really consider them as a whole and what's going to be beneficial to them.
She was struggling to breathe. She was like, she just couldn't catch her breath. She had oxygen on and everything, and still the doctors wanted to do surgery, and they were sending her for testing and poking her and prodding her. And at that point, I had called the internist, her regular doctor, and I just said, this is not what she wants, and I really don't want to put her through this anymore. And she said, well, it's your decision to make. You know what her wishes are. She said, we can call hospice in, and we can bring her home, and you can take care of her there. And I said, that's what she would want.
I think it's really important just to have the staff coming in and just kind of take some of the burden off of the family, off of Mary. Just let them know that we're here, anything we can do for them. They maybe have questions, not sure if something's normal, something's abnormal, and they just need that just extra person verifying that you made the right decision keeping your mom at home. Really, the aggressive treatment isn't what was best for her right then.
As quickly as I had made that decision, I just felt a weight lifted off my shoulders. I just knew that I was making the right choice, and I knew that this is what she wanted, and so we took her home.
End-of-life care is very difficult because I think a lot of times people feel like when they say they're stopping going to the hospital, they're stopping the doctor, they're stopping the lab work. Some family members feel like you're giving up. You've given up on mom, you've given up on dad, and we want them to know that you're not giving up. Hospice isn't giving up. Hospice is what you do whenever you've run out of aggressive treatment option.
Got her home, and hospice came out that afternoon. They were there by like 2 o'clock. They brought equipment out, a hospital bed. They did everything, and they were there with me through it all, which I couldn't have asked for anything more.
Because they were really committed to keeping Catherine comfortable in her home. They wanted her to stay there. They didn't want something to happen where she would need to go back to the hospital, and they were just really warm to the staff. They let us in, just treated us like family.
Jennifer was wonderful. The social workers that came in to take care of my mom, the home health aide that came every day and helped bathe her, and just, you know, they were all so comforting. And she knew that what was going on, even though she couldn't communicate it to us, she knew. This went on for about 2 weeks. And then she just, you know, gradually stopped eating, and there was not really, you know, she slept more periods at the time, and was harder to arouse and whatever, and she just kind of went off to sleep, and it was just really very peaceful. We were with her, you know, a good part of the time, and it just was a wonderful experience.
The majority of our patients are in the home, and they're able to be cared for exactly the same as if they were in a facility with the same standard of care. I think that especially for patients, oftentimes towards the end, they get more confused. They're only recognizing certain family members, certain faces, and they have the comforts of home. They can look around their room, they know where they are, they recognize their family members who are able to be there all the time. And I think that that's something that's really missing in a hospital or in a hospice home, that even though you are being kept comfortable there, it's not the same as being home. Anybody who's ever been in a hospital or had a loved one in a hospital knows that there's just no substitute for being at home.